On December the 16th, there's no point in trying to put any window dressing on this. We've lost 60 more people since Monday. 60. You know, that makes the consecutive days, I think, or, you know, like Monday was 42 or 3, Wednesday 59, Friday 37, today, and I'm getting messed up here, but 37 rather Monday, and let me back up, 59 on Friday and 42 I think on Wednesday before. But if you look at these numbers, whether it be 43, 59, 37, 60, it's just not good. I got 60 people to read. I'm very honored to read every last one of them. We now have 1,039 people that have died in West Virginia. The 979th death of 52-year-old male from Ritchie County. The 980th death, a 94-year-old female from Harrison County. The 981st death, a 41-year-old female from Berkeley County. The 982nd death is 66-year-old female from Cabell County. The 983rd death, an 86-year-old male from Monroe County. The 984th death, an 86-year-old female from Monongahela County. The 985th death, a 72-year-old female from Hardy County. The 986th death, a 72-year-old female from Wayne County. The 987th death, a 76-year-old female from Fayette County. The 988th death, a 92-year-old female from Kanawha County. The 989th death, an 89-year-old male from Greenbrier County. The 990th death, an 89-year-old male from Mineral County. The 991st death, a 92-year-old male from Hardy County. The 992nd death, a 96-year-old male from Mineral County. The 993rd death, an 80-year-old female from Mineral County. The 994th death, a 78-year-old male from Mineral County. The 995th death, an 82-year-old female from Mason County. The 996th death, a 78-year-old male from Taylor County. The 997th death, a 78-year-old male from Hancock County. The 998th death, a 67-year-old female from Mineral County. The 999th death, an 89-year-old female from Putnam County. And I never, ever would have dreamt in a million years that I would be sitting in front of you and read the 1,000th death in West Virginia. You know, all the graphics or all the parameters, everything said, West Virginia, you're the oldest. West Virginia, you're the sickest state. West Virginia is surrounded by border states and population beyond belief all around you. West Virginia, you're going to have a crisis like you can't imagine. Well, we haven't had that. But I surely, to goodness, hate like crazy that I have sat here and have read now, or getting ready to read, West Virginia's 1,000th death is a 63-year-old female from Pleasants County. Our 1,001st death is a 74-year-old female from Morgan County. Our 1,002nd death, a 50-year-old male from Marshall County. Our 1,003rd death, an 84-year-old male from Roane County. Our 1,004th death, a 63-year-old female from Mercer County. Our 1,005th death, an 81-year-old female from Cabell County. Our 1,006th death, let me back up. Our 1,004th death is a 63-year-old female from Mercer County. Our 1,005th death is a 94-year-old female from Cabell County. Our 1,006th death is an 81-year-old female from Cabell County. Our 1,007th death is a 78-year-old female from Jackson County. Our 1,008th death is a 68-year-old male from Summers County. Our 1,009th death is a 76-year-old male from Kanawha County. Our 1,010th death is a 79-year-old female from Kanawha County. Our 1,011th death is an 83-year-old female from Kanawha County. Our 1,012th death, a 92-year-old male from Kanawha County. Our 1,013th death, a 53-year-old female from Cabell County. Our 1,014th death, a 92-year-old female from Wyoming County. Our 1,015th death is a 76-year-old male from Brooke County. Our 1,016th death is a 76-year-old female from Lewis County. Our 1,017th death is a 79-year-old male from Hardy County. Our 1,018th death is an 82-year-old male from Greenbrier County. Our 1,019th death is a 76-year-old male from Brooke County. Our 1,020th death is an 81-year-old female from Ohio County. Our 1,021st death is a 69-year-old male from Ohio County. Our 1,022nd death is an 83-year-old male from Hancock County. Our 1,023rd death is a 75-year-old male from Mercer County. Our 1,024th death is a 62-year-old male from Marshall County. Our 1,025th death is a 79-year-old male from Wetzel County. Our 1,026th death, a 73-year-old male from Wetzel County. Our 1,027th death, an 87-year-old male from Morgan County. Our 1,028th death, a 92-year-old female from Marion County. Our 1,029th death, an 85-year-old female from Wood County. Our 1,031st death, a 90-year-old male from Pocahontas County. Our 1,032nd death is a 73-year-old female from Marshall County. Our 1,033rd death, an 88-year-old female from Marshall County. Our 1,034th death, an 84-year-old female from Cabell County. Our 1,035th death, a 73-year-old male from Kanawha County. Our 1,036th death, an 82-year-old male from Putnam County. Our 1,037th death is a 64-year-old male from Kanawha County. Our 1,038th death is an 83-year-old female from Berkeley County. Our 1,039th death is a 68-year-old male from Kanawha County. I say it over and over, but please keep them in your prayers and thoughts. And we're battling our way through this, but we've got a ways to go. And our nation is absolutely, I showed you the maps the other day, and our nation is covered up with this. We're trying to get our vaccines out as quickly as we possibly can, and I'll get to that in just a second. We've had 1,141 new cases in the last 24 hours. Our daily positive rate is at 10.27 for the day. Our cumulative rate is at 4.18. Our active cases are a little over 21,000, and our recovered cases are 44,550. We have a record high of 766 patients that are hospitalized, and we have 197 patients in the ICU. Yesterday, we didn't test as many. That's why our positivity rate is way up on the day. We only tested 8,800 people in West Virginia yesterday. Our reproduction numbers at 1.11 were the 10th worst in the country. We have 41 counties now that are in red or orange. And I'll just go to a couple of reminders real quick. You know that if you're 65 years of age, you better really be on your toes. And what I mean by that, and I'll get to it in just a second, but there's three things that are absolutely for certain. When this vaccine becomes available to you, take it. Take it right then. If you get feeling the least bit bad in any way, I don't care, like I said, if you get a toenail ache, go to the emergency room or go somewhere and get a COVID test. If we can catch this before the 6th day, or really in the first 2 or 3 days that you test positive, the antibodies will probably make you well. If we don't catch this in the first 6 days and you're above 65 years of age, you're in real trouble. You're in real trouble. Don't sit at home or wherever saying, oh, it's just a cold, it's just a flu, I've just got a headache. Go get tested the very split second that you have any kind of symptom of anything. And if you're tested positive, the antibodies will save your life. If you don't go, and you go past 6 or 7 days, the antibodies are almost worthless. You have got to go when you first have symptoms. We know that people above the age of really probably close to 65, but absolutely above 70 or 70 and above, 77% of these deaths are those people. Can you imagine this? I mean, what are we going to be if this thing just keeps running rampant all over our people that are 65 years of age and greater? How much wisdom have we lost? How much experience have we lost? What would happen if we just continue to deplete our elderly? It's just like we're lining them up and they're dying and they're dying and they're dying. What happens to us? What happens to all of our traditions and knowledge and all the goodness about their wisdom? We're losing them. We're losing them really fast. The vaccine on Monday was distributed, and lots of people were wondering, how you feeling, Governor? How you feeling and everything? Look, I tease the state police all the time. You'll catch me doing this and everything because the state police came to me and said, oh, my arm's hurting really bad and everything. Look, my arm hadn't hurt me at all. I mean, really and truly, other than just a teeny little bit of, of feeling, nothing. No, it didn't hurt me a bit in the world, and really I felt great. Kathy's felt great, other than giving the state police a hard time and teasing them and everything. We've done that, but nevertheless, we feel great. If if this vaccine becomes available, please, all the people out there in the state of West Virginia get vaccinated. Now, I did it for a lot of different reasons, but the primary reason was really and truly so I could sit with you and let you see if I was willing to take it. I've got the best advisors on the planet, and I've surely got a good brain to be able to tell me take it or not take it. It was painless. There was nothing to it. And look at all the tens of thousands in the trials that have taken it. And really and truly, do you really want to risk? Do you want to risk all the knowledge, all the science, all the everything about this and say, no, I don't want to take it versus the possibility of getting it and me sitting here reading your number? Not smart. Not smart. Now, we're pushing the vaccines out the door as fast as we possibly can, and we're distributing them all across our state. Our Guard and all the health people are doing a phenomenal job. I mean, that's all there is to it, and we're going to stick right behind that, but I'm going to push them and push them and push them. To be perfectly honest, if they got out, 93.9%, that would be great. I'd pat them on the back and I'd say it's not good enough. We've got to get them all out. And we got to just keep doing it and keep doing it and keep doing it. Now, our long-term care vaccination stuff, I want to read this to you and everything. There's a whole lot here that I probably need to go through. I'll go through it as fast as I can. CVS and Walgreens have an agreement with the federal government to vaccinate nursing home residents across the country through a voluntary program. They have said they expect to administer the first Pfizer vaccines on the 21st. Now, I know that our nursing home community is moving ahead and moving ahead quicker than this. We have already You know, the December 21st date is 5 days from now, when they said they're going to initiate the first residents. Now, stay with me, because this is good stuff. You know, the federal government is going to get this out to our nursing homes in 5 days from now. We've already tested or vaccinated 2,000 people in our long-term care facilities and their staff, you know, and so we're moving. And we decided to use a different approach for our program because West Virginia had over 40% of our pharmacies are not chain affiliated. We have instead partnered with all the pharmacies in West Virginia. We felt that from a state perspective would be our limiting, you know, would be limiting our ability to rapidly distribute and administer the vaccine to the population in need if we had gone with the federal program. Where our data indicates that nearly 50% of the deaths in West Virginia come from the assisted living or nursing homes, our intent is to, within the next 30 days, and we're going to beat this because 30 days is too long, we will have vaccinated all the nursing home and assisted living facility staff and their residents. Now, look, we were the first in the nation to be able to step up and test all of the people in our nursing homes, the first in the nation to test all the assisted living. We want to stay just right on top of that curve, and we want to be the first again. Now, we have a guest online with us here and everything. His name is Todd Jones. He's with AM/FM, and he is the president of AM/FM Nursing and Rehabilitation Centers and is joining us today. And Todd's going to give you an update on the vaccinations at your facilities.
Okay, thank you, Governor. I just want to thank Governor Justice, Secretary Crouch, Dr. Amjad, Dr. Marsh, and General Hoyer. They have been excellent to work with throughout this pandemic. They realized very early on that this is a very contagious virus that has a disproportionately high death rate for elderly with underlying medical conditions. And that is the exact profile of folks that are in our skilled nursing facilities and assisted living facilities. So thank you for that. As the governor was talking about, he mentioned the aggressive plan. We have, it's my understanding that the vaccines arrived on Monday morning, and by Monday evening, the National Guard had delivered all of the vaccines to our pharmacy, which is Lifetree Pharmacy, our in-house pharmacy that's doing all of our vaccinations. We then turned that around, sent it out to the facilities overnight, and began vaccinations early yesterday. So the speed with which this is happening is amazing. We're hoping to be done before most other states even start. So, but yesterday we vaccinated 1,830 people in 16 of our 19 AM/FM facilities. Today we are having clinics in 14 Stonerise facilities, and by the end of today we will have vaccinated just our own Lifetree Pharmacy 25% of the skilled nursing facilities in the state of West Virginia. I have to admit, yesterday was the best day of work that I've had in 9 months. To see the residents and the employees so happy to kind of see the end in sight of this. It's in sight, but people have to get the vaccine. It is a safe vaccine. We need to urge people to take it at the first opportunity you have to take it. Yesterday, I watched my mother get the vaccine, who has been a 3-year resident at Cabell Healthcare Center. And this is so very important to me, not only professionally, but personally as well. And so I thank everyone that is on this briefing for your diligence and hard work. And thank you for the opportunity to come on and tell you our story. So thank you.
Thank you, Todd. We appreciate you and appreciate all you're doing, and keep the pedal down. I mean, that's all. Don't back off. Don't back off now. I mean, you're saving lives every day doing this and everything. Stay after it. Okay, I want to read to you some more about an allocation plan update. I know many of you want to know when you and your loved ones can get your COVID vaccines. Again, our planning and decision making is based on four key principles. They're right up here. Reduce the rate of hospitalizations, reduce the rate of deaths, protect the most vulnerable, and ensure that our state can maintain critical services. Now, as we talked Monday, phase one is made up of the most vulnerable and populations, along with the first responders and the public health officials. And today I want to go over with you phase two, the phase two distribution. Phase two will begin, I hope and pray that phase two will begin in the early days of March. And at that point in time, we'll be reaching out to all of our population. We'll start with anyone over the age of 60, and then we will drift down to anyone over the age of 50 that has some level of pre-existing conditions that we can get a note from a physician or whatever like that. And again, I have to tell you that 97% of the deaths are in excess of 50 years of age. And so, like I said, phase two and phase 2A, 2B, 2C, they'll come very quickly, and let's just stay at it in every way. I want to go back to one thing, just one other thing, just 1 second. In sitting with Dr. Burke yesterday, she's an amazing lady, and what I loved about her is she doesn't, just have a gift of gab. She is right to the point, and there's sometimes, she says she stepped on a lot of people's toes. She's always been extremely complimentary of West Virginia. You know me well enough to know that, I'm not going to sit here like a politician and say, oh, everybody's bragging on West Virginia, blah, 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 and everything. I'm going to just tell you the truth, and she was very complimentary. She was very complimentary of our school map, as frustrating as that's been from time to time. She was very complimentary of the fact that a lot of states adopted some version and then put their little twist on it so they could run out and say how good they did and all that. But the biggest thing, which was so impactful that she was saying, was just this: we have got to realize as a population, and please, West Virginia, just listen to one thing. She said so many people that are 65 years of age and older are getting some level of symptom, and they just dismiss it as, well, that's a cold or that's a headache or whatever it may be. And they do not go at that time to check and get a test and whatever it may be. And all they're doing is signing their death certificate. That's what they're doing, because a pile of those will die. All I'm saying is exactly the same thing. Exactly the same thing. If you have some level of symptom, you don't realize the antibody drugs that our president took, that Rudy Giuliani took. Absolutely, when we can identify this quickly, we'll make you well, or we'll try awful hard to. If we don't identify this for 6 or 7 days, a lot of you are going to die. Now, the other thing she said is just this, is we have got to turn our focus away from, somebody that may have several different risk factors. They're overweight, they've got diabetes, whatever it may be. We have got to first and foremost dial in, and I said it yesterday, I was splitting the bullseye. We got to dial into one thing just about age, and age. So, with all that being said, we're on it. Our people are running to the fire in a lot of different places. You know, without any question, I tell all the guard, our healthcare people, anybody and everybody that's administering this, the faster we get it out the door, the more we'll get. The slower we get it out the door, the less we'll get. Yesterday, a letter was published and that was signed by over 30 healthcare leaders from diverse healthcare fields, including medicine, pharmacy, nursing, physical therapy, public health, hospitals, and long-term care. And the letter basically was saying, we want to be perfectly clear. This is a quote. We will get vaccinated as soon as it is our turn, and we will recommend it to as soon as possible to our family members and our patients based on the guidance of the CDC. We trust the process, and we think that you should also. Now, from vaccine reminders, you know, the COVID vaccine will protect us from the virus. There's no way in the world that you can get this virus from taking the vaccine. You have to take 2 doses. You can't commingle. You've got to take Pfizer. You can't take Pfizer, Moderna. You know, you've got to be Moderna. And when that comes out, and again, until you and all the people who live with us are vaccinated, the absolute best defense we have goes back to this mask. So continue to wear your mask, please. Our testing sites are up there. The drive-through pharmacy stuff's there. I encourage you, go get tested. Go get tested. We have 18 outbreaks and 67 confirmed cases in our public schools. That's not very many. That's still great and everything, but we've got a pile of our state that's not going to school. You know, our long-term care facilities, we have 116 outbreaks in our long-term care facilities. We have 16 active outbreaks in our churches in 15 counties. That's Braxton, Greenbrier, Harrison, Jackson, Lewis, Marion, Mineral, Mingo, Monongahela County, Nicholas, Raleigh, Summers, Taylor, Webster, and Wyoming counties. You know the drill on the churches. Pew in between you and wear your mask. And please, if you're 65, I'm pleading with you to stay home. Just stay home from church. Get your services online. You know, the good Lord is reaching out to bless us in every way. He's sending us the vaccine. We know really and truly 2 months from today, things should be a lot better. And really, you know, unfortunately, churches are an area where we can really have a real problem. In our corrections, we have 254 now inmates. That's down a little bit from 360 on Monday. You know, all but 3 of the positive inmates at Pruneytown have now recovered, and we had 54 cases there, so 51 have recovered. The number of inmate cases in the 2 northern facilities, you know, are now 195. There's been 50 recoveries there so far. Corrections also had 24 inmate cases at St. Mary's and at the Central Regional Jail, and 13 at the Eastern Regional Jail. There's 46 active cases throughout active staff cases throughout corrections, and that's down from 78. You know the drill on the mandatory face coverings. Please wear your mask. Go get your flu shot and give blood. Give blood and plasma. It's needed so badly. We've now awarded in excess of the $225 million that we were first at 200. We modified it, I don't know, to 210 or 215. Then we went to 225. We're now up to $233 million, right at $234 million. It's been awarded, and as through our deadline, which was yesterday, and so we'll continue to process and get those dollars to our cities and our counties. From West Virginia's standpoint, our unemployment numbers. Our unemployment number now is at 6.2%, down another 0.2% from the previous month. This marks the 7th consecutive month that our unemployment rate has gone down. The number of unemployed, of our state residents is still at 47,600 people, and our total employment in the month of November jumped 6,400 people, and that's really good. The national unemployment rate is at 6.7. Ours is at 6.2. West Virginia's unemployment rate has been lower than the national average in 5 of the last 7 months. I want to tell you real quickly about a great friend, a great person that served this state for the last 4 years and did an amazing job. That's all there is to it. That's Austin Caperton. He was our secretary of the Department of Environmental Protection, and what a job he did, and I can never thank him enough. Austin has been a lifelong personal friend, and we've known each other forever. He's ingenious in his thoughts. He has so much compassion and love for West Virginia, but just like all of us, at some point in time, Austin wants to go on and do some other things with his life, and he's told me about some things that are really intriguing. I'm not going to bring them up and everything, right now, but they're private business things, and he's been in private business all of his life, and I wish him and his family the very best. What a great man. How blessed we were to have him for 4 years. I'm sure he won't run off and leave us forever, but again, Austin, I congratulate you, and I want to just touch on just a couple of things here. The DEP, under his guidance, made historic progress in several areas, including $100 million grants that were distributed about our abandoned mine lands pilot program, and helping West Virginia meet, and get this now, we met all the requirements for the first time in 40 years on the federal ambient air quality standards. EPA came, congratulated us over and over and over. What an accomplishment, and so Secretary Caperton will be leaving on Monday, January the 18th. That is the end of my current term, and he said he wanted to stay to the very last day, in regard to my first term, and I'll work on appointing, another secretary of our Department of Environmental Protection. We will select a superstar there, but I'll tell you this man will be missed. Austin is a good man, and what a job he's done. Now, another thing, and this has come from Steve McDaniel and all the great people that are working, this is a little bit lighter note and everything, but all the great people that work at DNR, but yesterday I announced at my request, the West Virginia DNR will stock 30,000 trout over the next week in streams around the state so anglers and their families can enjoy fishing opportunities during the holiday season. Hopefully it won't be too terribly cold. I want to tell you a story real quick about that in just a second, but I've been a fisherman forever, and I love all the aspects. I told you, I showed you that sunset the other day. I've told you about the scarlet tanager and all the incredible stuff that's out there. So go out over Christmas and everything and enjoy some great fishing. There's plenty of water in our streams now. That makes for really good stuff. And there's a full list of locations that's available on my website. And I want again to remind all people to go buy their license. I think by the end of the year. Is that the date that was the time where they could, we've got a Santa hat on a trout. I love it. That's pretty neat. Oh, aren't y'all just ingenious and everything? But let me tell you this real quick. A long time ago, I went into Cranberry. There were some guys that I was going in there with, and I couldn't get there. There's a fellow that went with me. His name's Gary Dean. He went with me, and we were so excited to go, and we went in the middle of February or early February, and it was so cold, and there was snow like crazy on the ground, and it was snowing. I mean, it was really snowing. And they were supposed to meet us at the Pheasant Hollow Shelter, which is 5 miles from the lower gate at Cranberry. And off we went, and we didn't get to the lower gate till about midnight, and they were supposed to be there, have a fire, they were going to have the food, They went in the middle of the day, and we were just carrying all of our gear, and in there we went. We had our sleeping bags and all the stuff like that. And in there we went, and when we rounded the Pheasant Hollow shelter, there was probably, at that time, probably 13 or 14 inches of snow on the ground, and it was cold as it could be, and nobody there. We didn't have any means to make a fire. We didn't have any means of nothing, and I thought, man, are we in a mess? And I happened to have a box of matches that I always carried with me in the side waterproof area of my hunting jacket, and we crawled underneath the shelter and got enough wood to finally get a fire going. The next morning, we were really hungry. And the next morning, we were going to catch some fish, and believe it or not, and I know you're going to think, well, he's really telling a tale now, but the real truth is just this. We went out that river, and it was snowing, good gosh, and there was big chunks of ice floating down the river and everything else. We tried to fish. You couldn't possibly fish because ice was freezing, not only on your guides, but on your line. Your reel wouldn't function and everything else. And about that time, Gary saw a fish in the stream and literally just reached his hands down and caught that fish. So we laid our poles down and we started just walking the banks, and we were catching the fish with our hands, and then we some ways survived and got out of there. But it was an eventful time, I'll promise you that. But I'll tell you this, it was a memory I'll never forget. Maybe not the most pleasant memory, but a memory of beauty and everything that I won't forget either. You know, go out, enjoy absolutely this fabulous state. There's so many wonderful, wonderful, wonderful memories out there just waiting on you. And so I'm really happy. So to our great person, our great leader of the band, Steve McDaniel at DNR. Steve, you just keep doing great work. The reason they've got these fish is they grew more than what they expected. And so we're able to do this. It's a good time of year to do this and everything. Those fish will do great in those waters, and go enjoy. That's all I've got for right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. Excuse me. Good afternoon. And just to reinforce a couple things the governor said, and then perhaps to add a couple more things, that all of us were immunized with the Pfizer vaccine on Monday. And I think just like the governor and the first lady, I have had no real side effects of the vaccine. My arm was a little bit sore for a day or so, but on a scale of 1 to 10, probably a 1 or maybe a 1.5. And so, for us, we have certainly had really no real effects that were negative in any way. But remember, getting this vaccine is so important. And even if you do have a little bit of soreness of your arm or something else, that just tells you your immune system is getting activated to be able to produce that response that's very specific, that will block the virus from infecting you if you ever became infected or exposed to that virus. The vaccine is not a complete vaccine. It's only it's a synthetic genetic code for only a little part of the virus, and therefore you cannot possibly get the virus. A lot of misconceptions. There is no sterility from having an immunization. Pregnancy by the Advisory Committee for Immunization Practices, the expert group from the Centers of Disease Control, is not a contraindication. Having had COVID is not a reason not to get the vaccine. The only real reason not to get the vaccine right away would be that you're actively infected with the virus and you're isolated, or you have an active infection with fever or something else at the time you're ready to get the virus, or that you've had a really bad allergic reaction to a component of the virus, or you've had a life-threatening reaction. And if you've had a life-threatening reaction, but not to ingredients in the virus, that still is a situation that you could still get vaccinated after discussing with your doctor. So the vaccine is safe, it's really effective. In the clinical trials, which had over 70,000 people in them from Pfizer and Moderna, and 95% of the people that got the virus were protected from getting infection And as we look, I'm sorry, let me say that the other way. Of the people that tested positive for COVID in the trial, only 5% of the people had gotten the immunization with the active form of the Pfizer vaccine or the Moderna vaccine. And the rest of the people actually got the control, got the water injection to compare the impact of the vaccines. So the vaccines are really effective, and nobody died in the trials from COVID. And only one person in the Pfizer vaccine actually got sick enough to be hospitalized. So this is a really good protective vaccine. It's a very innovative design, and it's something that we all feel that it's safe, and we have taken it ourselves as people saw. So I will transition. Now, the governor had talked to us about the phases of the vaccine, and I just want to review really briefly, what is the science? What's the reason behind the way that we're doing this? And as the governor said, Dr. Birx was in Charleston, spent almost 2 hours with our leadership team and gave us many, many pearls of wisdom. But the key message that she gave us, and I want to review what the data is again briefly, is that the single most important parameter as we inject people to protect, to do what the governor's asked us to save lives, to maintain vital capacities in hospitals and health systems and in the communities and in our state, is to focus on people that are older. And as we look at the data, we reviewed this with you last press conference, but I'll do it again quickly. As we look at our own data, the average age of somebody, and the governor just read the over 1,000th person that's died in West Virginia from COVID-19, the average age of death is 77 years old. And when we look at people 70 and older, 70 and older, then 77.5% of the people that have died in West Virginia from COVID-19 are over the age of 70 years old. If we look at 60 to 70-year-old, 14.25% of the people that have died of COVID-19 have been between 60 and 70 years old. So if we include the 60 and 70-year-old and above 60, then that is 92% of all the deaths from COVID-19. And if we add the 50 to 60-year-old group, which is 5% of that total number of deaths, the people that have died of COVID-19, then we cover 97% of all the people that have died. The CDC, the Centers for Disease Control, has put out guidance to reinforce how important age is. And if you look and compare to 18 to 29-year-olds, which are deemed to be a very healthy sort of age range for us to compare normal healthy people, then if you look at people 50 to 64 years old, their risk of hospitalizations is 4 times what 18 to 29-year-olds risk are, both of whom would be infected with COVID-19, and the risk of death is 30 times higher. And if we look then at people 65 to 74, then their risk of hospitalizations is 5 times higher than 18 to 29-year-olds, and the risk of dying is 90 times what 18 to 29-year-olds are. If we look at 75 to 84-year-olds, the risk of hospitalizations is 8 times what 18 to 29-year-olds are, and the risk of dying is 220 times greater. And if we look at the over 85-year-olds, then their risk of hospitalizations is 13 times higher than the 18 to 29-year-olds, and the risk of dying is an amazing 630 times higher. So when we start to look at trying to reduce the stress on hospitals, and the governor said that we have more West Virginians in hospitals with COVID-19 today than we've ever had before, and we start looking at saving lives and maintaining vital capacities, then we want to target the sectors that are both important for that capacity commitment that the governor has instructed us to make, and then start very quickly to start to accommodate the older people in our population. And so when you look at phase, and Jordan, I don't know if you can throw up the graphics, but when we start to look at phase 1, and we look at generally in phase 1, we are going to focus as the advisory committee to the Centers for Disease Control suggested, in our first 1A, our most important category, is hospital workers in acute care hospitals, and look at people who work around airways because they come into more contact with COVID-19. We look at our long-term care industry, and as Todd Jones just told us, that we are very aggressive with the governor's orders and commitment to focus on nursing home residents and staff, because these are the people that die the most frequently. And remember, we are immunizing a lot of our hospital workers and our nursing home workers, so we maintain those vital capacities. But we also recognize that people that work in hospitals and work in nursing homes that are following the appropriate precautions, the spread of COVID-19 in these facilities from a patient, from a person infected to another person inside the facility is actually much less common than people that catch COVID in their own homes. And so as we look at the targeted population, the nursing home population is very, very critical, the residents, because these are the people that account for 47% of our deaths. And then we focus on pharmacies. And the reason why pharmacies are so important to us, because the network of how we handle and pass off the COVID-19 vaccines in the state are from the hubs to pharmacists. And we're working with Krista Capehart, who's done a spectacular job for us, who works both at WVU and with the state pharmacy association. And we've created a whole network of pharmacists, and that's how we make sure that we are handling each vial correctly and that we are making sure that we're not wasting a single dose. So then when we go to phase 1B, then 1B is again, this community infrastructure, looking at EMTs, emergency medical personnel, looking at police, fire, public health officials working in local health departments, the National Guard that's supporting this effort. And in phase 1A and 1B, we will immunize all people irrespective of age. And let me just make one important point, that we are not just haphazardly selecting these people. We are working with governing associations, for instance, the West Virginia Hospital Association, to help delineate with the hospitals what the hospitals need, with the Long-Term Care Association to figure out what the nursing homes need, with the city and county, with the county and state officials, including DHHR, Bureau of Public Health, to figure out what we need to do for the people in 1B. So we're really following the governance of the overriding the umbrella organizations over these. Now, when we get to 1C, we are going to make a bit of a change. So as we look at other healthcare, which will include the remaining hospital staff and people that work in clinics and outpatient areas, people in home health, people in hospice and other areas, we're really going to focus on that group of people in the higher age groups, because we know that if we appropriately wear protective equipment, personal protective equipment, the spread of COVID-19 inside these facilities is pretty rare. But what we want to do is we want to make sure that we have that workforce, and particularly that we start to protect the people in that workforce that have the highest risk, as I mentioned earlier, of having severe disease or who could die from COVID-19 infection. And then we get to 1D, and we start to look at other people in the communities and other people in the state that are vital for our capacity and continue to deliver services. This will include people in the food industries, utilities, transportation, higher education, K through 12. And so as we look at this group, again, we'll initially focus on people 50 years old and over. And I should have added that for the 1B phase, we've also added dentists, because dentists have higher risk because they work right around the airways of people. So that's phase 1. And this phase is really meant, as I said, to be informed by the agencies that oversee these industry sectors and help us understand who these vital people are. But these different phases are not sequential, or not inflexible. It's not like we do phase 1A, then 1B, then 1C. So we're working very flexibly, because for some of these sectors, the over umbrella organizations might say, we don't want to send all these doses right at first. We want to distribute these doses over a few weeks so we don't disrupt vital functions of these types of organizations. So there is a flexibility to this, but these are the priorities for phase one. Now, phase two, which the governor mentioned, we really want to start them focusing at the general population and particularly the people that are older. So what the governor said and what I recount as far as the science, we know people 70 and above account for 77% of the deaths that we have in West Virginia. And when you look at people in those age categories, their risk of dying versus 18 to 29 years old by the CDC is 220 to 630 times higher. So we really want to start to identify those people that are older, 80 and older, 70 and older, 60 and older. And then we want to look for people who have pre-existing health conditions. But instead of us trying to determine which pre-existing health condition is more important than another, what we're going to do is we're going to ask their healthcare providers to write an order to get them into this higher level category so that we're very inclusive, but we're also selective because we want to make sure that we're using each dose of the vaccine wisely. And we'll come out with more guidance about how we're going to do this and how we're going to identify those specific people in these populations. In phase 2B, we're going to look at these other sectors that we started in the phase 1C and 1D who are under 50 years old, and we want to immunize them. And then as we get to phase 2C, we're going to get to the rest of the population. And so as we start to look at this, the guidance that we had from the governor, maintain acute healthcare assets and capacity. And we do that by both immunizing the healthcare workers, but also trying to target our immunizations to the people that are likely to get the sickest, to end up in the hospital and to die of COVID-19. And that's the other main directive, is save lives by the governor. And then by administering vaccine to these vital community, workers, whether it's first responders or vital utility workers and or people in the education field, and vaccinating those people in the higher risk categories first, I think we're able to meet the commitments of the governor, yet also stay within what Dr. Birx suggested we do. So thank you very much.
All right, thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Just highlight quickly that the Joint Interagency Task Force work continues to move smoothly, focused on continuing the current work that needs to be done for administration of vaccines, as well as prepare for the next round of vaccines that will arrive in the state, and as well work through with the various organizations, as outlined by Dr. Marsh, the preparation for the next groups going forward. As I've told the folks in the JIADF on a regular basis, we continue to work with deliberate speed. We go fast, but not so fast as to make mistakes, and we'll continue to work in those areas that we need to. We have worked around a couple of weather issues for the next couple of days, and that's all gone smoothly and effectively. As with the governor, First Lady, and Clay, I tolerated the vaccine exceptionally well, no problems. Just a little bit of a sore arm. Somebody and several people have asked me, would I recommend my family, particularly my wife and my mother, get it? And absolutely. When their time comes and it is available to them, we absolutely want them to do that. So we continue to work hard on support to DHHR in other areas and our local health departments, to include contact tracing and sanitization missions. As I close out, Jordan, if you could roll a video. This is a video of Sunrise or Sundale Nursing Home. As you guys may remember, this was the first nursing home facility that was hit exceptionally hard at the start of the pandemic. And yesterday, through a lot of great work from the Interagency Task Force, two persons in particular that we want to point out that received their vaccine, Shannon Taylor and Bob DeVault, who both spent a significant amount of time in the hospital and on ventilators, but were able to make it through that process stepped up and took their vaccines to show people that it was important to get that done. So a lot of great things went on yesterday at Sundale as well as across the state of West Virginia, and we will continue to stay focused on the governor's vision to press us to get things done and get our nursing homes and our other facilities taken care of. Thank you.
All right, thank you, General. Dr. Amjad, our State Health Officer, and Bill Crouch, Secretary of the West Virginia DHHR, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask a little bit more about the plan to vaccinate our nursing home population. So I understand the initial plan, but could we talk a little bit about the plans to go back and give everyone the second shot that they need? Thank you.
Maybe Dr. Amjad, you can do this one because this is really straightforward. I mean, I'll just add one thing, Charles, real quick. The federal government, once you have received a shot, automatically that goes in the chain. That the follow-up shot is set aside to come out to where you get the second shot right off the get-go. But anyway, Dr. Amjad, maybe you can add to it.
Sure. Hi, Charles. Sure. So the Pfizer vaccine is 21 days after the initial one, and the Moderna later will be about 28 days. But as the governor mentioned, those are kept in a computer system. So everyone who got the shot will, about 21 days afterwards, will have a system in place for them to get the next one. But it has to be the same one. So Pfizer ones will have to get another Pfizer vaccine. Moderna would have to get another Moderna vaccine. But those are kept in a computer system log, and we'll be able to keep track of the individuals. But those will be sent in line, and we don't have a problem keeping track of everyone, but those are systematically kept in place. And we do need to remind everyone they do need to get the second vaccine. We get that question a lot. It is not effective unless you get the second vaccine for patients and staff, but that will be set up in place, and we'll have that ready to go. Thank you.
Great, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass from Channel 8 and Fox 11. Governor, this may be a little bit off the reservation, but I wanted to ask you, there seems to be at least a lot of people, or a growing chorus of people who are looking at the surge numbers and looking at the death numbers and looking at the number of people going to the hospitals. And they're saying, have the governor do something, close something, do something, move something. And you've said many times that this thing is hitting us from everywhere. And you don't have any proof, scientific proof of targeted shutting things down being effective. So my question to you is, how much do you think of what's driving not only how you're handling this, but how people are responding to this, maybe more importantly across the state, is being driven by science and what we see in the data as far as our reactions and your decisions? And how much of it is basic human nature to want to do something, to do anything sometimes in the face of a crisis, just to feel like you've taken action, even if there may not be scientific basis for that? Can you touch on that for me and give me your take on how much do you think that might be driving the bus? Thank you.
Well, Kenny, I can. I won't go on very long, but look, when I came to this job, not as a politician. I'm not going to be a politician. I came to this job and didn't whine around about, oh gosh, why do I have to go through all this as the governor? No other governors have gone through it. I said it was an honor. I also said that I have, in my opinion at least, I really truly believe that God above places us in different things for reasons. And he placed a governor here that's done a lot of stuff. And I've been under fire a lot of different times. And I'm not going to dive in the ditch and panic and everything else. And the last thing in the world that I'm going to do is just do some symbolic something, knowing that it's not going to really benefit anything to a significant amount, and knowing that it can hurt some people, by shutting something down or whatever. I'm not going to do just some symbolic something to make me feel good or to make a political move or to make it look good. On the other hand, let's just think back. You know, not very long ago, I came out before anybody really had ever decided to move, and I said, we've got to shut the winter sports down. We had already started girls' basketball practices, and boys' basketball was starting the following Monday, but we've got to shut it down, and we've got to shut it down right now. At the same time, we removed the social distancing and made masks mandatory in all public buildings, you know, outside of your homes. You know, there was other things that we've done right along, and I can tell you that I have not hesitated a bit, whether you go all the way back to the state tournament or shutting schools down or shutting our visitation down to our nursing homes and on and on and on. I haven't blinked anywhere, but I absolutely am not going to deliver you something that in my heart I really believe, well, all I'm doing this for is window dressing. You don't have a window dressing governor here. You don't have a politician here. You got a guy that's going to operate to the very best of his mind and his gut that he can possibly operate. And some of these decisions are made through all the intel that we can come up with, but they're also made with your gut as well, as just what you really feel. I've tried everything within me in telling the people how serious this is and how absolutely big a dilemma that our entire nation is in, and trying to bridge and get us to that vaccine. If along the way our medical community had told me, they'd come to me and said, Governor, we got a real problem in this area and we need to close this and close, we'd have done it. We'd have done it in a second. We even ran down the rabbit holes and everything to really double check to see if we could trace stuff back to bars in a certain area, and we came up with zero. So from the standpoint of just stepping back and hurting a few in order to look good, you got the wrong guy for that. That's not me. So we're going to continue to do what's right by the science, and we're going to continue to try with all in us to get us across the finish line, you know, in as painless a way as we possibly can.
All right, thanks, Kenny. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. We cover a lot of ground in these briefings, and I am wondering about finances. Now that we're about halfway through December 16th, could we have a similar session, a breakout with Revenue Secretary Hardy and whoever else provides guidance on CARES funding? I'd like more insight, for example, into a few matters, including whether West Virginia is gathering $700 million in invoices to provide the federal government, if those invoices are going to add up to what West Virginia has in the bank, whether the state needs to demonstrate what it's done with the millions of dollars allocated to unemployment benefits, not just allocating it, but that money going out the door to those who are unemployed, and whether there's any assurance that the U.S. Treasury considers medical access highways a necessary expenditure. Those are a lot of questions, and it just seems like we could stand to have a whole session dealing with the finances. Thanks.
Well, Brad, I'll tell you what we'll do. On Friday, I'll bring in Secretary Hardy and maybe his team, and you know, they can go over this and everything to make people feel a little bit more warm and fuzzy, but I can promise you this, every single day, every day we meet on exactly what you're talking about. And I've said it over and over and over, the numbers and everything are coming together, and the numbers, you know, from time to time we've had to change, just like the awards to our cities and our counties had to go up. You know, from time to time you have to change from the standpoint of testing is becoming a great big expense. You know, we didn't have to send out as much money for small businesses. We didn't get the response there. You know, so we picked up a little bit there. We've picked up a little bit in different places. You adjust and you move it and everything else. But I've said it over and over, Brad, you know, we're making this all come together. We're making it come together as best we possibly can. We're dialed in and watching this stimulus package that could come out that could change the rules of the game again and could actually even give us extensions or more monies and everything. I mean, just think about it. there's two tranches of big money, three that are sitting out there right now. The first tranche is the reimbursement of the workers' comp fund, or the unemployment fund rather, that we spent at $267 million. So that's sitting out there to move to the very second that the federal government comes out and says they're going to forgive that, then that becomes real money back to us. And from that standpoint, then they will absolutely give us extended time to spend that money. But if they don't, we have set that aside to cover that right back out of the CARES money that we were allowed to do so, in order to be able to protect all of our businesses from rate hikes out the moon. I mean, 5 times what our current people are paying our small businesses, our businesses in the state. So there's that. There's what we call the deep dive part, where we are reimbursed for dollars throughout the government, through dollars that we have spent. And that number is a big, big, big delta. The auditor's department has that. They're working through all that and everything. And absolutely, that will happen, just boom. And then from the standpoint of additional dollars that are out there that we're watching, and we're watching how they all come together, it's additional unemployment dollars. And so there's different tranches that are really significant monies and everything that are moving out there and everything. We're trying to protect our counties and our cities as the way we're doing it, but trust me, we're meeting every day. I'll bring them in here where they can tell you the same thing that I've already told you, but this thing's going to come together, and we're going to just go right across the finish line, just with absolutely the handling of these dollars, absolutely just almost flawless. That's what we're going to try to do.
All right, thanks, Brad. Next to Mark Curtis with Next Star Media.
Good afternoon, Governor and cabinet members. Governor, I recall early on in this crisis with the testing, you received requests and you abided by them to target certain minority communities, heavily populated African-American communities, because they had higher risk for heart disease, obesity, diabetes, and therefore were at greater risk for COVID. I'm wondering if you're going to do something similar with the vaccines now in terms of targeting high-risk minority populated areas.
Mark, we've had this discussion a bunch. I think Clay, you can jump in and tell them of the discussion we had probably, 3 weeks ago or 4 weeks ago, and we've had this a bunch of times.
Yes, thank you, Mark. So we have a African American task force, and we certainly are very committed to making sure that we're approaching vulnerable people and communities, and looking at the social justice issues related to vaccination. As part of our plan, we are confident that the way that we're rolling this out, both through these different sectors that we talked about in phases 1, and also in the phase 2A, where we start to look at people who are both elderly in age and also have pre-existing medical conditions, that we will have focus on this particular sets of communities, and they would also include Hispanic communities and Native American Indian communities, which people are at higher risk, although there's fewer of these folks in West Virginia, as well as looking at people with chronic medical problems. We do have representatives on the JIATF, the Joint Interagency Task Force, that will help focus attention on these communities to make sure that we are effectively starting to identify people in these communities that both need the vaccination, and also work with leaders in these communities to make sure that people feel confident that that when we deliver vaccine to the communities, that people do feel confident that the vaccine's safe and trustworthy and will take the vaccines. Because remember, it's not just vaccines delivered or targeted, it's really people who get vaccinated with the vaccines. So thank you.
All right, thank you, Mark. Next to Kelsey Soto with WSAZ. Kelsey, I think we're having some audio issues. We'll come back. Next, let's go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I was wondering if there had been any contact tracing data available yet on the effect of Thanksgiving on the spread. And also if there's anything else that someone with an older person in their house could do other than masking and socially distancing and things like that to protect them as we go through the Christmas holidays.
Paul, the only thing I'll add is just this, and I think probably, you know, maybe Dr. Amjad, you could jump in and add something to this, but Paul, I love what Dr. Burke said the other day when she said, you know, if you're in excess of 65 years of age, you know, and you were going over to your kid's house or they're coming to your house and whatever like that to exchange presents or whatever like that over Thanksgiving, over Christmas and everything, you know, if you're masked and they're masked and you're not there long and everything, it's probably relatively safe. But if you have kids that are, you know, really young kids that are not masked, she wouldn't think that it was safe to do. So, Dr. Amjad, maybe you could add something to that.
Sure, Governor. Paul, the governor answered pretty much for the Christmas holidays what we would recommend for, you know, staying masked if you're going to open up presents, and then just limiting your time indoors, but for everyone just to stay masked. To answer your question about Thanksgiving, we have seen what we would consider some of the surges. You know, there are some days we've seen 1,200 cases, 1,300. One day we saw about 1,500 cases. So we're pretty much in that post-Thanksgiving season that people expected. We are concerned with Christmas coming up that we're going to see some numbers, if not higher. So we do want to encourage people to try not to, you know, travel too much if they do not have to, or to maintain, you know, limited contact with large gatherings and to wear their masks. But the governor did mention some recommendations if you are going to see some family members to stay masked, especially around older individuals. But there are ways to do that safely, as mentioned. Thank you.
All right, thank you, Paul. Next, we'll go to Joe Buchanan with WDTV.
Good afternoon, everyone. Joe Buchanan, WDTV. I want to touch on the partnership between the state and Vault Health. If you go on the website now, it says the West Virginia at-home testing program has been paused. I was wondering if you could speak a little bit about why that program was paused, as well as if this program will be brought back at any time.
Secretary Crouch has got to do this one, please.
Yes, Governor, thank you. Hi, Joe. It's a question I addressed last Friday, I believe, with regard to our decision to pause the in-home testing. There were a couple of reasons for that. One was on the higher end of our cost or expenses with regard to testing per test. But the other reason was it was taking a long time to get results back. We've talked about turnaround time before. And when labs begin extending that turnaround time where we don't have the information we need on positive cases to do that investigation and do that contact tracing, we really allow much more community exposure than is necessary. So by the time an individual would make that request, there had to be a face-to-face telemedicine call with the company. They then mailed out the test to the individual. That test arrived within a reasonable amount of time, but then the individual had to find the time to do the self-swabbing and then take that test and send it back, so that there was then travel time or time with regard to the transmission or the moving that sample back to the lab, to the individual and back to the lab. So the time ended up being somewhere around 5 days or so, and that's just too long. We did discover 50 some positive cases. I think there are a few more tests that are still coming back in. The numbers on those were somewhere around 1,673, I believe, in-home tests done. I don't have the total number of positives because we don't have all those back in yet. But that was at $119 per test, which was a little high from the standpoint of some of the other companies we're using. So those were the reasons why we did that. So thank you for your question.
All right, thanks, Joe. Next, we'll go to Junaid Dill with the AP.
Hi, Governor. It's Junaid Dill with AP We were wondering, have winter weather conditions impacted the delivery of vaccines today? And we're also wondering, when do teachers and people in prisons expect to get access to the vaccine? And have any other government aides gotten shots yet? I think you might have mentioned the First Lady. That's all. Thank you.
I think General Hoyer, you can you can answer this and go with it. Go with it, sir.
Yes, sir. So we have had a couple of local health departments that have asked us to hold vaccines at the hub until weather passes in a couple of areas. Then we'll distribute those tomorrow. As far as the teachers and prison inmates, they are embedded in the phases that you've seen in the documents outlined, and we have started the process of working with various constitutional offices and working on the process of providing vaccines to constitutional officers as well as key staff, and that is in progress as we speak right now. So I don't have numbers on that particular allocation.
All right, thanks, Junaid. Next, we'll go to Kelsey Soto with WSAZ.
Sorry about that earlier, Governor. I know before the Thanksgiving holiday, you had requested that schools return be pushed back so that we could look at the numbers and analyze those stats a little better. Do you anticipate needing to do that as well with the Christmas holiday coming up? And then I know we're hearing from some local school districts that teachers, they're taking surveys to see the interest in educators getting vaccinated. And there's some of them are hearing that those vaccines could be available as early as December 27th. So do you think that could impact, the first semester, the spring semester coming up here?
Say that again, please. Kelsey, the only reason I paused there just a second was I had different people here in the room that were saying that date is not correct. That's a wrong date. As far as your question, no, I mean, are we looking at the possibility of pushing the Christmas break back, past, and I think most of the schools go back sometime right after New Year's Day. And so, absolutely, Kelsey, that's something that's still on the table. It's on the table every day. I really believe that our Department of Ed and our superintendents and everything, all of our teachers, all of our service personnel, those people are doing an amazing job. I mean, when you just look at the number of outbreaks in our schools and all the stuff that's happened there, it's amazing. It is really good. But we're watching that, and we're going to make the best decision we can possibly make. We moved all the winter activities back to January the 11th. To be very frank with you, that's a date that may even get pushed back even further. We've got an opportunity here to really stop this thing in its tracks and put a real dent in the whole thing and get this thing moving back our way. And not only do we have the opportunity and the power of the mass to really just do the very best we possibly can. And God knows, I mean, really and truly, I mean, if we're just smart people and we realize this, if we hadn't worn these masks, in all honesty, where would we be? I mean, for crying out loud, we could have deaths like absolutely crazy, and it would just be unmanageable beyond belief. But with all that, we do have a real opportunity with this vaccine. We'll continue to watch, and if we get closer, we'll make the decisions on moving it out or not.
All right, thanks, Kelsey. Next to David Beard with the Dominion Post.
Hi. We've made it repeatedly clear that the vaccine is safe, and we're glad for that. And I wanted to just follow up on something that was on those lines that was raised kind of in passing on Monday regarding the EpiPen issue, and then again today, just because that raised some questions. Does the fluid that carries the spike proteins or whatever contain some kind of known allergen? And frequently doctors don't know what's in the medications they're prescribing. They rely on the pharmacists or the handout or going online for someone to know it. So will the person be able to get a piece of paper, ask for a piece of paper that lists the ingredients of the vaccine before they take the shot to make sure that they don't have any allergies to the ingredients? Thank you.
Dr. Marsh, this is way, way, way above my pay grade, so, so you're going to have to do this one.
I appreciate that, Governor. Many things you do are way above my pay grade. So we talked with Dr. Birx about this actually on Monday as well. And there is a component that the Pfizer vaccine has in it called PEG, or polyethylene glycol. And the belief, at least currently, is that may be the ingredient that certain people are having a response to. So if people out there have ever been told they have a reaction to PEG or polyethylene glycol, that would be certainly something that would be important to make sure that that is addressed with your doctor before you would think about the Pfizer vaccine. The Moderna vaccine, as I understand, does not have this ingredient. The other issue, though, just for people generally, David, is if you have had a really, really bad reaction, a life-threatening reaction where your eyes swell shut, or you can't breathe very well to anything, whether it's an immunization or it's peanut butter or it's bee stings, and you would know that because your doctor would have told you to carry an epinephrine pen and EpiPen with you. So if you're a person who carries an EpiPen with them, and epinephrine is a hormone that can be given in the leg muscle, which is really quite life-saving if you ever had this kind of really severe life-threatening reaction, which is really very rare. But if you have that reaction, absolutely talk to your healthcare provider, your doctor, your allergist, whoever, before you come to get the vaccine, just to make sure that that's safe, and make sure that you mention that to people that are giving the vaccine. And the recommendation is if you know there's a component of the vaccine you're allergic to, then you shouldn't take it. But indeed, most people won't know that, and most people won't be allergic to that specific problem or that specific part of the vaccine, but may have other things that really stimulate their body to respond really vigorously, like I mentioned. And if you've had that reaction, you have an EpiPen, then you should talk to your physician before getting vaccinated.
All right, thank you, David. I'll turn it back to you, Governor.
Okay, a lot of good questions. We appreciate them all. You know, I mean, y'all are getting feedback from the public, and that's always really good stuff. You know, we want to make sure and tell you that the National Guard is making sure that we have the EpiPens at all the distribution sites and everything to make sure that we don't have really a disaster there and get somebody with a bad reaction, that we'll be able to take care of it with the EpiPens there. But all that being said, again, I thank everybody for their questions. I want to go over just real quick. It won't take me but a second and everything, because I'll be right to the point. There are three super main points of where we are today on December the 16th. We need to consider just what my dad used to say about how to build a road. 3 ways to build that road: drainage, drainage, drainage. If you want to locate a fast food place or whatever, a retail store, it's always location, location, location. What we have learned as we've gone through this process is this is absolutely age. That's the first thing. The second thing is just this: if you're 65 years or older and you get a sniffle, any kind of a thing that is different, headache or whatever, please go get tested right then. Because if we can catch it early, you'll get antibodies, and these antibodies will absolutely knock this thing out. If you don't, like I said, and it's terrible to say this, but a bunch of you better get out your pen and start writing, you know, your last will and testament, because we're going to lose a bunch of you. And the last thing is this: and Paul brought up a question about this and everything, was talking about, I think, people getting together over Thanksgiving and all that, and talking about this from the standpoint of younger people being there and everything, and how we're going to do that. And Paul, the bottom line of the whole thing is this: we are now discovering more and more and more that people between the age of 18 and 35 years of age, between 18 and 35, there is bukus of people out there that are asymptomatic and are spreading this and have no idea they're doing it. No idea whatsoever. And so we're making a real push to try to head that off at the pass. We're going to try with all in us to test all of our colleges and our universities weekly, and maybe that will lead us to testing maybe all of our government people, from the age of 18 to 35 weekly, and maybe that will lead us to test all the people that are in the hospitals weekly, and that absolutely will give us another line of defense here to be able to stop this thing. Because they themselves are spreading this as innocently as we can possibly spread it, because they have no symptoms. They have no symptoms at all. And the worst of it all is just this, is if we identified them and we said, Sally, you've been tested positive, and Sally responds beautifully. If we come to Sally and we say, Sally, you've been tested positive, tell us all the people that you've been around the last whatever days. And she'll then say, well, I haven't really been around people, because she doesn't want to tell on people. So the long and the short of it is just this. We've got to identify those spreaders, and then there was another thing that was brought up about the National Guard and how the National Guard was moving, and they were moving very, very fast and everything. John Wooden, who was at UCLA, I think they won 10 consecutive, or I know they won 10 national championships under his reign. He used to always say a saying that I say to my basketball team all the time: be quick, but don't hurry. And that's what our great National Guard's doing every day. So to all of you that are asking the questions, thank you so much, and thank you, West Virginia. We're going to get through this. Hang tough. Thank you.